You ever look at a dental x-ray and just think, how in the world can they see anything in that blurry shadow? It really is a puzzle, right? You're trying to understand a three-dimensional tooth from a totally flat two-dimensional picture. But dentists have this incredibly clever trick up their sleeve. Today, we're going to crack the code on how they find that hidden third dimension. So here's our game plan. We'll start with what an x-ray can and can't do. Then we'll get into the secret clues dentists are looking for. We'll tackle the big problem of things overlapping in the image. And then we'll introduce the amazing solution, the Slob rule. And finally, we'll see how it all works in practice. All right, first up, the x-ray's shadow. See, before we can get to the solution, we've got to really wrap our heads around the problem and the built-in limits of a 2D image. So let's ask the big question. What can an x-ray actually tell us? I mean, these images are super powerful, no doubt, but they definitely have their blind spots. And honestly, what they can't see is just as important as what they can. And here is the key difference. An x-ray really can't see the health of the pulp, the living tissue inside the tooth. An infection could be hiding right there in plain sight and you'd never know. But what it's fantastic at showing is hard tissue. If that tiny, thin white line of bone around the root, it's called the lamina dura, if that's broken or just missing, well, that's a huge red flag for dentists. Okay, so if x-rays have these blind spots, how do dentists figure things out? Well, they basically become detectives, decoding all the hidden clues in the radiograph. And these are the clues they're hunting for. A break in that lamina dura bone line, that points to an infection coming from inside the tooth. But here's the catch. The infection has to get big enough to actually eat through the dense outer bone of the jaw to even show up on the x-ray. Other signs, like the root itself starting to dissolve, that's called root resorption, can be a sign of a long-term problem. And this is super important. If you see a dark spot on the x-ray, but tests show the tooth is still alive, then you know the problem is coming from somewhere else entirely. But this is where the real challenge kicks in. What happens when all the clues, or even the tooth roots themselves, are stacked right on top of each other? This is what we call the superimposition problem, and it can turn a simple x-ray into a serious puzzle. This really gets to the heart of it. On an x-ray, you can see things side to side, you can see them up and down, but what you can't see is front to back. Is one root canal in front of the other? Is a broken instrument on the cheek side or the tongue side of the root? If you don't know that, your treatment is basically just a guessing game. So how do we solve this thing? Well, lucky for us, there's this brilliant and honestly surprisingly simple technique that dentists use, and it lets them unlock that third dimension using their standard x-ray machine. It's time to introduce the Slob rule. The solution isn't some crazy, expensive new scanner or anything like that. Nope. It's just a really elegant technique that involves taking a second x-ray from a slightly different angle. That little shift in perspective, that's all it takes to see the depth that was hidden just a moment before. And it all boils down to this one acronym, SLOB, same lingual, opposite buccal. This simple phrase is the key. It lets a dentist know for sure if something is on the lingual side, that's the tongue side, or the buccal side, the cheek side. Let's see exactly how it works. Okay, so this is the physics behind the magic. It's a cool phenomenon called parallax. You can try it yourself right now. Hold two fingers up, one in front of the other. Now close one eye and move your head from side to side. See how the finger closer to you seems to move way more than the one farther away? That's parallax. And the exact same thing happens here. The object that's farther from the x-ray film, the one on the cheek side, will appear to move in the opposite direction of the x-ray machine. Theory is great and all, but let's make this crystal clear. We're going to walk through a real-world example of how a dentist uses the SLOB rule to figure out which root is which when they're overlapping. Okay, let's walk through it. Step 1, you take the first x-ray, and the two roots are just stacked, one on top of the other. Can't tell them apart. Step 2, the dentist shifts the x-ray tube just a bit towards the front of the mouth, that's the mesial side, and takes a second shot. Now look, the roots have separated on the image. Step 3, this is where we apply the rule. Which root looked like it moved in the same direction as the machine? That's your lingual root, the one on the tongue side. So same lingual. And that means for step 4, the other root, the one that looked like it moved the opposite way, that's got to be the buccal root on the cheek side. Same lingual, opposite buccal. And just like that, the puzzle is totally solved. And really, this is the most important thing to take away from all this. Don't just memorize the letters S-L-O-B. Try to actually visualize it. Picture those two roots, one behind the other. Imagine the X-ray source shifting and just see how their shadows dance and move on the film. Once you can really see that in your mind's eye, you'll get the simple genius behind the SLOB rule.